Sciatica is a cop-out diagnosis. It's just telling you your sciatic nerve is not happy. To me, purpose of diagnosis is to tell you exactly what's happening with that patient. Sciatica is a loose term. It's not a diagnosis to me, it's descriptive of a symptom. It means the sciatic nerve is inflamed. The sciatic nerve is the longest nerve in the body. It originates from this nerve, the fourth lumbar nerve, the fifth lumbar nerve, the first and second sacral. And some people, there are variations. 4 nerves from the lower back. Sometimes could be 5, but very, very rare. Some anatomical differences exist, but generally speaking, I would say L4 to S2, 4 nerves. Combine, form, goes back here, under the buttocks, down the leg. Sciatica is not a muscle issue, it's a nerve issue. And that issue often and always comes from a compression that exists oftentimes in the spine, resulting from a slip disc. Symptoms: pain down one leg. Usually sciatica, by definition, is on one side. But it can happen both sides, but they don't say, oh, that's not sciatica. Well, it is sciatica, bilaterally. That's happened before. But one side will predominantly be more painful than the other. Then it turns into numbness and tingling, and eventually becomes weak. Sciatica is due to compression of the fibers that form the sciatic nerve. The sciatic nerve gets its name as a sciatic nerve in this point in my buttocks, because fibers from here, 2 fibers from here, they come together, form one bundle, go down through here, under my buttocks, and at that point where they form one bundle is then referred to as sciatic nerve. And it goes down behind my hamstring, right directly behind my hamstring, right about here, then it branches out, multiple fibers going all the way down. But the important thing to realize that sciatica, to me, as I said, is a cop-out diagnosis. Because it's just telling you your sciatic nerve is not happy. To me, purpose of diagnosis is to tell you exactly what's happening with that patient. Sciatica is too loose. But what they say now, based on studies, at a minimum, 95% of all patients with sciatica have a spinal disc issue. I happen to disagree. I happen to believe everyone with sciatica will have a spinal disc issue. I have not seen a condition where there's a sciatic nerve or sciatica-like symptom and there's no disc damage. In every case that I've seen, there's some disc involvement. But the degree will differ, could be from mild to moderate. The most important thing that you have to realize for sciatica is that when, as I said, that is from a disc, but it's not going to be just involving your disc. It can also trigger muscle reaction. Our muscles are covered with fascia. The muscle and the fascia that it's covered with, especially in the back, in the buttocks, down the back or side of the leg, these all get their neuronal stimulation, their nerve supply, from the lower back, from the same fibers where the sciatic nerve comes from. So if the nerves in here are irritated, these muscles, including the ones on your bum, the hamstring, the IT band, the calf muscles, they all get irritated too. When a muscle is irritated, it can contract. It can be spasmodic. It can stay tense. And over time, then that becomes a problem in itself. You develop trigger points. And that will make this worse, and this will make those worse. And if that goes on, then you'll have myofascial pain syndrome. The fascia that covers the muscle also gets damaged. Everything is supposed to be elastic. The elasticity is gone, so the stretchability is gone. The tissue covering the muscle is damaged, the muscles inside is damaged. Those two damage combined is going to make your sciatica worse. And when it comes time to get treatments, you got to address all of those issues. Which is why a lot of times when I say, is it painful here, is it painful here, I look for those trigger points or myofascial points. Because addressing only this part and not here, it's not helpful for you. And you have to be careful not to do things that would make it worse. The do's and don'ts. A reminder for you all. Maintain good posture. Take breaks. When you're sitting for a prolonged time and no movement, pressure builds and builds and builds. Just getting up and walking around mobilizes things. And when you get up, put your hands here and feel how much movement there are right in your spinal column, right next to your fingers. You will notice it does one of these things when you walk. Every single joint in your body, where the sutures in your skull, the joints between your toes, the joints between your spinal segments, with every step, they mobilize. And it's good for them because it detoxifies them. It depressurizes them. Mobility is good. So take breaks. Sleep on your side. Right side is best. But right side is best only because it's good for the brain. What's good for the brain is good for everything else, because the brain covers everything. Now, what to do? Exercise and stretching, in order to be beneficial, has to be condition specific and age appropriate. Two of the things that most patients miss. Muscles are important. Not that it's not as important as, let's say, your disc. Your disc is most important because it protects nerve, canal, CSF flow, everything else. But if you have disc problems, if you have a nerve impingement, you will develop muscular issue. You will develop problems with your fascia. And if you don't fix those things, it will never recover. So, a good stretch to do. You have to break that. Only when you're ready. If you're not ready, you do these exercises, you create more problems. But there has to be fascia exercises. There has to be stretching of muscles. This one, I'm pointing here. This is for the psoas. It's a major hip flexor. It attaches under your belly, spinal segments here, and down to the hip. Big muscle, two of them, major and minor. And everyone who has back issues will have a psoas issue. And you need to stretch it. Aside from it, there's psoas release techniques. I did it for you earlier. Okay? It's not comfortable, but it's needed. Why? Because when you release this, yes, it's not part of the sciatic nerve, but the entire body is connected. It's part of your pelvis. When this is tense, you will have a tilt. That will impact sciatica. What happens here is not isolated. This impacts this, this impacts this. Yin and yang. Muscles have agonist, antagonist. For every movement, there's an opposite muscle that does the opposite. Psoas is this. So you have to stretch it. The best way to stretch it is to, I sat on a small little stepping stool and I pushed and leaned back. If you're not ready for this and you do this, you'll have a lot of pain. And if you have a spondylolisthesis, a situation where the bone also slips in addition to the disc, you have no business doing that. So when I recommend these exercises, it's not for everyone. Make sure, if you're my patient, we talk, we tell you. If you're not one of my patients, you talk to your doctor and you make sure it's done, it's specific for you before you just, oh, he talked about it in his talk. Not just because I talk about it, it doesn't mean it's right for you. These are good exercises, only if it's appropriate for you. So yes, while this is good for certain instances, it's bad for others. If you have a stable sciatic and stable disc, in other words, you're stabilizing, and now you want to make sure you don't go through the same thing, because recurrent neck and back issues are common. Over and over and over, they get better. They say, well, it's coming back. I thought I was over it. No, as soon as you get improved, you get over it, that's not when you, okay, I'm going home. No, the game is not over. That's when you start these things to make sure it doesn't come back again. Okay? This is good. Psoas stretch. Quadricep stretch. You hold. This one you kind of lean back a little bit to get the psoas going. This one is mainly for front of the thigh. So it's, as you can see there, did this, and then you push back until you feel the burning, the stretching, but not that level. Okay? A little bit. Hamstring. Nothing too aggressive. A lot of times people say, oh, lay down and pull your leg. God, that's going to be too excessive. The sciatic nerve goes down the back. You pull it down like that, it's going to stretch and it's going to become flared up. Whether you have sciatica, disc bulge, disc herniation. Some people will say, I'm going to crack your back. Others will say, I'm going to grab your neck and yank really hard while my buddy pulls on your ankles. And some will say, no, we need a little bit of steroid injections. Others will say, you need a little surgery. I wouldn't recommend any of those. The cracking and twisting, even if it's done by a very well-experienced chiropractor, should not be done on the spine that has a damaged disc, because it will tear that spine apart. I am not a big fan of rotatory chiropractic manipulation. I only do them when I am 100% sure that there's no spinal disc damage. Because how can you be sure? So it's better to be safe than sorry. So some people have surgeries prematurely. I would recommend do not do invasive procedures. Not that they shouldn't be done. Yes, they have their place. There are times I cannot help. Sir, too late for me. You go talk to the surgeon. But even Harvard Medical School, Cleveland, Mayo Clinic, they all say one thing. If you have spinal disc issues, even if it's a herniation or bulge, surgery should be your last option. Exhaust, conservative route. Now, conservative route does not mean you go crack your neck and back. Get someone to do Thai massage on you or get your kid to walk on your back. It has to be condition-based and appropriate conservative care. Ones that don't harm. Okay? And then, on top of that, conservative care is not just that. In a day, there's 24 hours. I see a patient 30 minutes, 2 hours. What about the other 22 hours? You have to mind your posture, your habits, it changes. So start making these changes now.